It's a feeling many men over 60 know all too well. That moment of doubt. That quiet anxiety that creeps in when intimacy is on the horizon. It's the worry that things just won't work the way they used to. The frustration of feeling like your body is letting you down at the most important times. It's a deeply personal struggle. One that affects not just a man's confidence, but can put a real strain on relationships that have taken a lifetime to build. For too long. Erectile trouble has been seen as just an inevitable part of getting older. Something you just have to live with. Maybe you've tried a few things. Perhaps even talked to a doctor. Only to feel like the options were limited or didn't quite get to the root of the problem. It's painful to feel like you're losing a vital part of yourself. A part of your identity and connection with your partner. But what if I told you that the common understanding of this issue is often incomplete? What if the real reasons behind it, and the surprisingly simple ways to address them, are things that have even caught medical professionals off guard in this video? We're going to explore some surprising underlying factors and simple changes that can make a dramatic difference. It's not about quick fixes or expensive treatments. It's about understanding your body in a new way. You'll want to watch all the way to the end, because there's something truly surprising waiting that could change everything you thought you knew. Let's dive right into the first of these surprising areas that many people, and even doctors initially, might overlook when thinking about erectile function. It's something so fundamental to your overall health, yet its direct link to performance in the bedroom often gets missed. We're talking about your vascular health. Yes. But not just in the obvious sense of clogged arteries. We're talking about the delicate lining of your blood vessels, what doctors call the endothelium. Think of your blood vessels like a network of pipes. And the endothelium is the smooth inner coating that helps everything flow freely and allows the vessels to expand and contract properly. For an erection to happen, you need good blood flow and the ability of those blood vessels in a very specific part of your body to relax and fill with blood. If that inner lining, the endothelium, isn't healthy, this process becomes much harder. And what surprisingly impacts this endothelium: chronic low-grade inflammation and blood sugar control. Even if you're not diabetic, many men over 60 have some level of systemic inflammation or blood sugar fluctuations they might not even be aware of, or they dismiss as minor. They might have slightly elevated A1C levels, or maybe their fasting glucose is creeping up, but it's not yet full-blown diabetes. Or perhaps they have inflammatory markers elevated due to diet or lifestyle. This constant low-level assault on the endothelium makes those blood vessels stiff and less responsive. It's like trying to push water through a garden hose that's become hard and brittle. Doctors are increasingly realizing that erectile dysfunction is often one of the earliest warning signs of cardiovascular issues, sometimes appearing years before chest pain or other heart problems. It's your body's way of telling you the small, delicate blood vessels are struggling first, and the ones responsible for getting and keeping an erection are particularly sensitive. So, what's a surprising way to support this crucial endothelial health? It's not necessarily about popping a pill to boost blood flow in the moment, but about long-term nourishment of those blood vessels from the inside out. And one of the most powerful tools in your arsenal is something you likely already have in your kitchen. Certain types of vegetables and fruits rich in nitrates and antioxidants. Think about leafy greens like spinach, kale, and arugula, or root vegetables like beetroot. When you eat these, your body converts the nitrates they contain into nitric oxide, a molecule that is absolutely essential for relaxing blood vessels and improving blood flow. It's like giving your blood vessel lining a smooth, slippery coating and telling the muscles in the vessel walls to loosen up. Making a smoothie with a handful of spinach or adding arugula to your sandwich every day seems incredibly simple. Almost too simple to impact something as complex as erectile function. But the cumulative effect on endothelial health and nitric oxide production is significant. And it's a connection doctors are paying more attention to as research reveals the profound impact of diet on vascular function beyond cholesterol levels. Beetroot juice, for example, has been studied specifically for its ability to improve blood flow and has shown promising results for men with ED, often surprising those who try it. It's not a magic bullet, but consistently providing your body with the building blocks it needs for healthy nitric oxide levels is a foundational step that many men bypass while searching for more complicated solutions. Another surprising area linked to erectile health, and one that often goes unaddressed, is the health of your gut. Yes, your gut. It seems completely unrelated on the surface. Right. What do the billions of bacteria living in your digestive system have to do with getting an erection, it turns out? Quite a lot. Your gut microbiome plays a critical role in inflammation throughout your body, nutrient absorption, and even hormone regulation. An unhealthy gut, often called dysbiosis, where there's an imbalance of good versus bad bacteria, can contribute to systemic inflammation. As we just discussed, chronic inflammation is a major enemy of healthy blood vessels, including those vital ones needed for erectile function. Furthermore, the gut helps process and regulate hormones, including testosterone, which, while not the only factor in ED, certainly plays a role in desire and function for many men. An unhappy gut can mess with this delicate hormonal balance. Doctors are increasingly looking at the gut-body connection, recognizing that issues starting in the digestive tract can have ripple effects on seemingly unrelated systems, like the vascular system and hormonal pathways crucial for erections. So, how do you address this surprising link? It's about nourishing your gut microbiome with the right foods. This means incorporating more fiber-rich foods that feed beneficial bacteria. Think fruits, vegetables, whole grains, legumes like beans and lentils. It also means adding fermented foods that contain live beneficial bacteria. Like yogurt, make sure it has live and active cultures. Kefir, sauerkraut, and kimchi. Again, this seems incredibly basic, almost too simple to be effective for something as frustrating as ED. But supporting a healthy gut reduces inflammation, improves nutrient absorption, including those needed for vascular health, and helps regulate hormones. It's a foundational health strategy that can have surprisingly positive downstream effects on erectile function. Many men focus solely on the physical act or obvious blood flow issues, overlooking the internal environment that makes healthy blood flow possible in the first place. By focusing on simple dietary changes to support gut health, adding a serving of lentils to your soup, snacking on a handful of berries, or having a small bowl of yogurt, you're addressing a surprising root cause of inflammation and hormonal imbalance that could be contributing significantly to your difficulties. It's a powerful, yet often overlooked, pathway to improving not just digestive health, but also the function of those critical blood vessels and hormones needed for intimacy. Moving on from the gut, let's talk about another factor that doctors are recognizing has a surprisingly significant impact, particularly on the hormonal side of things, and that's sleep. Now, everyone knows sleep is important for overall health, but its specific link to erectile function is often underestimated. During sleep, particularly during the deeper stages, your body performs crucial restorative processes. This includes hormone production and regulation. Testosterone, for instance, is largely produced during deep sleep. If you're consistently getting poor quality sleep or not enough hours, your testosterone levels can take a hit. While low testosterone isn't the primary cause of ED for everyone, it can certainly contribute to reduced libido and can impact the quality of erections for some men. More surprisingly, poor sleep also throws off other hormonal systems, including those that regulate stress hormones like cortisol. Elevated cortisol levels due to chronic sleep deprivation can negatively impact testosterone and contribute to vascular problems by increasing inflammation and blood pressure. It's a vicious cycle. Stress makes it hard to sleep. Poor sleep raises stress hormones, which then impact everything from mood to hormonal balance and vascular health, all of which are tied to erectile function. So, the surprisingly effective intervention here is focusing on improving your sleep hygiene. It sounds simple, almost too basic to address a complex issue like ED, But consistently getting 7 to 8 hours of quality sleep can have a profound impact on your body's ability to regulate hormones and repair blood vessels. This isn't just about being in bed for 8 hours. It's about getting restorative sleep. Practical steps include creating a regular sleep schedule, even on weekends, ensuring your bedroom is dark, quiet, and cool, avoiding screens for at least an hour before bed, and limiting caffeine and alcohol, especially in the evening. These small changes can make a big difference in the quality of your sleep and, consequently, in your hormonal health and ability to manage stress, both of which are surprisingly linked to your performance in the bedroom. Doctors who delve deeper into a patient's lifestyle when addressing ED are often surprised by the significant improvements seen simply by optimizing sleep patterns. It highlights how interconnected our body's systems are and how neglecting a fundamental need like sleep can have cascading negative effects that show up in unexpected ways, including erectile trouble. It's a powerful reminder that sometimes the most effective solutions are not complex medical interventions, but rather a return to basic, fundamental health principles that support the body's natural functions. Another area that's gaining more attention from doctors, and which might seem counterintuitive to some, is the surprising impact of specific types of exercise, particularly those you might not immediately associate with erectile function. Most men know that general cardiovascular exercise is good for blood flow, which is key for erections. But we're talking about something a bit more targeted, something that directly impacts the muscles and nerves involved in the process. Enter pelvic floor exercises, often known as Kegel exercises. Traditionally, these exercises are associated more with women for issues like bladder control, but men have pelvic floor muscles too, and strengthening them can have a surprisingly positive impact on erectile function and control. These muscles are located at the base of your pelvis and play a role in blood flow to the penis and the ability to maintain an erection. A weak pelvic floor can contribute to venous leakage, where blood drains out of the penis too quickly to maintain firmness. Learning how to identify and train these muscles can make a significant difference. It involves squeezing the muscles you would use to stop the flow of urine midstream or to prevent passing gas. You hold the squeeze for a few seconds, then relax. Doing sets of these holds and quick squeezes regularly throughout the day can strengthen these often neglected muscles. Clinical studies have actually shown that a program of supervised pelvic floor exercises can be as effective, and sometimes even more effective, than certain medical treatments for improving erectile function, especially in cases not solely due to severe vascular disease. This is where it gets surprising for many men, and even some doctors who haven't specialized in this area. The idea that simply flexing muscles in your pelvis can help with erections seems almost too simple to be true. But the evidence is there. It's a non-invasive, cost-free intervention that directly targets the muscular support system involved in the erectile process. Incorporating a few minutes of Kegels into your daily routine, maybe while you're sitting at your desk, watching TV, or waiting in line, is a surprisingly powerful tool that directly addresses a physical component often overlooked when troubleshooting erectile issues. It empowers you to work on a specific area of the body that is directly involved, providing a tangible way to improve both function and confidence. Finally, let's touch upon a surprising contributor that is often completely missed, and its impact can be significant. Certain everyday medications or even common over-the-counter supplements. Many men over 60 are taking medications for various conditions: blood pressure, cholesterol, depression, even heartburn. While these medications are necessary and beneficial for their intended purpose, a surprising number of them can have side effects that impact erectile function. For instance, certain blood pressure medications like beta blockers or some diuretics, antidepressants especially, SSRIs, and even some common allergy medications or prostate treatments can interfere with nerve signals, blood flow, or hormone levels necessary for an erection. What's surprising is that sometimes neither the patient nor even the prescribing doctor immediately connects the new onset or worsening of ED to a medication that was started or changed months earlier. Especially if the ED started subtly. It's often dismissed as just getting older, The key here isn't to stop taking necessary medication, absolutely not, but to have an open conversation with your doctor about all the medications and supplements you are currently taking, including over-the-counter ones and herbal products. Tell them specifically about the erectile difficulties you are experiencing. Your doctor might be able to switch you to a different class of medication that addresses your primary condition without the same sexual side effects, or perhaps adjust the dosage. Sometimes, doctors are surprised themselves when reviewing a patient's full medication list in the context of new or worsening ED symptoms, realizing that a subtle drug interaction or known side effect might be the primary culprit, rather than solely underlying vascular disease or age. This highlights the importance of being your own health advocate and openly discussing all symptoms and treatments with your healthcare provider. Don't assume the ED is just age. Consider if it started around the time a new medication was introduced or changed. It's a surprisingly common, yet often overlooked, piece of the puzzle in understanding and addressing erectile trouble effectively. So, we've covered some ground today, touching on areas you might not have immediately connected with erectile health, the health of your blood vessel lining influenced by inflammation and blood sugar, the surprising role of your gut microbiome, the critical importance of quality sleep for hormonal balance, the power of targeting your pelvic floor muscles, and the often overlooked impact of everyday medications. It might seem like a lot, but the core message is one of empowerment and hope. Erectile trouble isn't always just an inevitable decline due to age. Often, it's a signal from your body that something isn't quite right. And surprisingly simple. Fundamental shifts in how you eat, how you sleep, how you manage stress. And even simple exercises or a review of your medications can make a significant difference. Remember, you have more control than you might think. Making small, consistent changes can add up to big improvements. Adding more vegetables to your diet, getting a bit more fiber, paying attention to your sleep routine, practicing those simple pelvic floor exercises, and having an open dialogue with your doctor about all your health concerns and medications. These aren't quick fixes, but they are powerful steps towards addressing the underlying factors that can contribute to erectile difficulties. It's about nurturing your body's intricate systems, supporting blood flow, hormone balance, and overall vitality from the inside out. This holistic approach, focusing on these sometimes surprising connections, is what doctors are increasingly recognizing as crucial for men's health as they age, including sexual health. Don't feel discouraged or alone. This is a common issue, and there are actionable steps you can take starting today. Think about which of these areas resonates most with you. Maybe you know your sleep isn't great, or perhaps you've suspected your diet could be better, or maybe you just started a new medication recently. Choose one area to focus on first. Make a small change, and build from there. Small changes truly can make a big difference to your health and happiness, including reclaiming intimacy and confidence. We'd love to hear your thoughts and experiences. Have you tried any of these approaches? Did you find a surprising factor that helped you share your story in the comments below? Your experience could help someone else. If you found this video helpful and insightful, please give it a thumbs up to let us know. And don't forget to subscribe to our channel and hit that notification bell so you don't miss out on more content like this. Helping you live your best life at every age. Taking proactive steps for your health is the most empowering thing you can do.